Hey guys, welcome back to the Best Practices Show podcast. You know the jam around here. I find the coolest people in all of dentistry. Some of them are great friends, incredible influencers, and amazing speakers in dentistry. And today, I'm not going to disappoint. Because not only is she a great friend, but she's an awesome speaker and one of the heroes in dentistry. Rachel Wall, we're going to be talking about why every dental practice needs a clinical leader. Do you have one? If you don't, you have to listen to this podcast. Rachel, thanks for being on. I always appreciate you.
Thank you. Always a pleasure hanging out with you, Kirk, and just chatting about dentistry and dental hygiene and what's happening in our world.
Yeah, absolutely. And I'll always tell this story. So I can't remember where we were. Maybe it was DC or whatever. And you were like, this was before you became the Taylor Swift of dentistry type of a thing. So like, I was like, that's Rachel Wall speaking right across from me. Like, I'm going to go over and say hi. And I had 2 people in my room and you had 2,000. So I was like, hey, and I introduced myself. I actually got in the line, the receiving line at the end with the velvet ropes. And I waited until
I remember. And we've high-fived in the middle of several hallways at big meetings over the years. And yeah, always fun to see you there.
It's always fun to chat with you. And so we're going to be talking. You'll see why in a minute. She's such a great human being and an incredible teacher. But I want people to, let's start here. I want people to know who you are before we get started. So if we have a lot of young listeners and new dentists, who's Rachel Wall? What do you do?
So first and foremost, I'm a mom, I'm a wife, I'm a daughter and sister and all those things. And about 30 years ago, a little bit more than that, I had a dental hygiene visit. I was an aimless community college student, and I had a very hardworking mother who was like, hey, you need to get a job. Like, you can't just hang out in community college forever. And I happened to have a dental hygiene visit, and here we are, 33 years later. So, so I've been a hygienist for a really long time. 20 years ago, I started Inspired Hygiene, and been super grateful to be able to do this work over the last 20 years and help a lot of teams really grow and develop and re-engage their hygiene department and help hygienists really step into their role as healthcare practitioner and be a part of their patient's healthcare team. And really, I don't say that just to be saying it because it sounds good and that's like the buzzword, but really, really to help them really look at their patients in a different light and help their patients get oral health and overall health results that also, by the way, are a win not only for the patient, but they're also for a win for the team and those hygienists, and it's also a win for the practice. So that's what we do at Inspired Hygiene. I work with an amazing group of other hygienists. We work together to go out and just inspire and support and help teams grow.
That's awesome.
Yeah.
That is awesome. And so you get a chance to see a lot of very cool practices in dentistry.
Yeah, we do.
And you and I are going to cover a lot of subjects in future podcasts. And you've already been on the podcast, which I love having you back again and again and again. But you mentioned the term clinical leader. And I was like, oh, let's go there. First of all, let's talk about the why before we get into the how. Okay, why? Why does every practice need a clinical leader?
Every practice needs a clinical leader because in order to maintain a certain level of clinical standards and patients achieving the clinical results that they're expecting and that you are expecting, whatever, regardless of your role in the practice, someone has to hold that torch, right? Someone has to set the standard, and then someone has to verify that the standard is being upheld consistently. And I do want to add something to that, though. The clinical leader isn't necessarily it's not a clinical dictator.
Okay.
Right? It's not a clinical dictator. So these clinical standards of care can be in lots of different categories, right? Obviously, at Inspired Hygiene, our category is the hygiene clinical standards, but they also can apply to restorative standards, surgical standards, orthodontic standards. When are we doing what type of treatment? If we have multiple options of treatment, what are the indicators that we're seeing with these patients that help us make decisions about what treatment is going to be in their best interest? And not every single bit of that can be put on paper, right? I mean, we're using our clinical skills and judgment regardless of the role that you're in or the type of practice that you're in. And those come from years of experience, from putting together all the pieces of that patient's puzzle with regard to their overall health, what their ideal outcome is. But having those clinical standards, at least a framework for those, helps you replicate them. So when you have multiple doctors or providers in your practice, they can be replicated with consistency. They can be communicated with consistency and clarity, right? So you have somebody new that joins your team as a provider. If you have these written standards of care, then you can communicate those clearly instead of just saying, yeah, if you see bleeding or you see any signs of periodontal disease, like we recommend, I don't know, I guess they need scaling and root planing. But there's so many nuances in that because really in dentistry, we have bodies, like I would say authorities, like let's use the American Academy of Periodontology as one, that set these standards, but really there aren't any required standards from one dental practice to another. So you might have somebody that comes in and their idea of what that means, bleeding and active periodontal disease, is very different than somebody else that's already in your practice. So when creating these standards that then can be led by the clinical leader, it's a collaborative process. So yes, there's a leader that makes ultimate clinical, diagnostic decisions, but getting those standards in place, we really see it works best to really have buy-in from everybody for that to be a collaborative process. So I just dumped a lot and we can kind of pull all that apart.
Yeah, I have so many questions too. So you talk about clinical standards. This is probably a pretty dynamic environment. So people that you get a chance to work with, you're constantly learning. I mean, if you talk about airway or implant or occlusion, you're always learning. So that's one piece of it. And the second piece is, you come back to practice and you now have team members. And so making sure that we're all aligned on how we're taking care of people is crazy important, don't you think?
It is of utmost importance, right? Continuity of care, right? Making sure that the patients are getting the same quality of care between providers,
right?
That they're hearing the same message, so that those clinical standards then have so many different pieces that go with how do we communicate that? How do we code for that? How do we deliver it clinically, right? It's so many different pieces of that are involved.
I can already think of a few dentists that I know that come back from a course, they're all fired up and they're talking about something and the team members in the room going, what is he talking about type of a thing? Yeah. And so that creates...
How are we going to do that? Right.
Yes.
Right.
So
how are we going to implement that? And then expecting the team to really implement it. I mean, that's why I know you and I and your entire team and mine too, we see over and over when dentists make the investment to take their team to any educational program that they're really serious about implementing, they're going to get a exponentially greater return on investment if the team is there than if they're not.
100%.
Yeah. And I think that's a good characteristic of a clinical leader.
Yeah.
Is willing to, when they know that there are going to be clinical philosophy shifts based on this thing that they're learning, who else do they need to bring with them that will be able to hear the the reasoning behind those shifts firsthand and really believe in it, because that's really what it takes, is that belief in those philosophies.
Yeah. So can I throw you a real world problem that we have a scenario. But Rachel, I'm going to pretend to be a team member. But Rachel, we have two doctors. They're really nice people, but they couldn't be more different in how they see dentistry and practice dentistry. And it creates a lot of, we actually came up with a system where they have their clinical team and they have their clinical team, and we couldn't agree to agree. So they're just doing it their own way. I'm sure you've seen that before, right?
Yeah. And that's one way to do it, right? That's one way to do it, is to have, almost like two practices under one roof, right? They have their clinical team. However, there will come a day in that practice when someone needs to see someone else's patient,
right?
Or when that doctor wants to have a little bit more freedom in their schedule, and, or maybe one of those clinical team members has as many patients as they can care for, and they need to make room on the schedule for new patients. And there's going to come a point in time where there is some type of growth desired, and that team will be very locked in, right, in that regard.
Mm-hmm.
So yes, we do see that a lot. And often it's multiple doctors, and one of their requests is help us elevate our hygiene team so that they can tee up treatment for us better, more effectively, more consistently. And what I mean by that is pre-educate the patient to what we are likely to diagnose. And they want all the hygienists to do this for all the doctors. And then, we kind of see it coming. I would say it's 90% of all multi-doctor practices have this issue, and at one point of the spectrum or another, right? So then what we typically do is we kind of get the hygienist, to themselves and say, okay, so how close are the doctor's treatment philosophies to one another? Because it's really asking a lot for the team. They're basically having to hold 2 or 3 or 4 different philosophies in their head, and then change their communication to the patient, depending on who's coming in to do the exam.
Right.
And if you have it planned out every day and which doctor's going to come in to do the exam, and it never changes, then it's possible, but I will tell you, it puts a lot of mental stress on the team that they could be doing other things. They could be connecting with the patients at a deeper level. They could be doing a greater handoff. They could be doing an even better job of pre-educating that patient, but they've got to toggle between all these different philosophies. And then, God forbid, if you just have, hey, whatever doctor's available is going to do your exam, then I'll tell you what happens. They don't do it. Mm-hmm. They don't. They're very vague with the patient. When the doctor comes in for a handoff, it's very difficult to know how to give them that information if everyone expects something different. So yeah, we tell the doctors, hey, you guys got to get calibrated first. And it doesn't mean you have to be robots and exact, replicas of one another. You can have some variances there, but on the core things, like when do we replace an old filling versus when we recommend a crown? Like, if you can just pick 3 or 4 of the core procedures that you see the most in your practice and get calibrated there, and communicate it to your team. We facilitate this all the time. I think it's helpful to have a facilitator. I'm sure your coaches do the same thing. It really helps. But if you can do that, you will see a dramatic increase in that co-diagnosis is what we call it.
Yeah, that's awesome. And that was one of my questions is, I do want to ask you about the how. Do you guys, I would imagine you calibrate through a document. We have determined these as our standards of care. I mean, at least coming together on a few things, right? Is that kind of how it works?
Yes. So we do have a document that we help our clients work through to establish these standards of care. And it's even goes to the frequency of like, what are the diagnostics that we're going to do to get to these decisions, right? What types of screenings are we going to implement in hygiene with new patients? You can make it as detailed as you want, but at least if you have the core things documented, then everybody knows what to follow. And then you're doing that collaboratively, right? It's a safe place. People have an opportunity to speak up if there's something that they're not comfortable with, or if they're wondering, how are we going to do that in our current workflow, right? Do we need to change something? I'll give you an example of a client we worked with. The hygienists were being called in to do anesthesia for a lot of the doctor appointments. But what they weren't doing is they weren't doing the core dental hygiene diagnostics. So the time that they would typically have in that appointment to do oral cancer screening, consistent periodontal charting, including, bleeding and recession and all the things that we need to include. The restorative screening to see, like, is there anything that I'm seeing that's been treatment planned that we need to really call out today? All the time spent doing that, what would normally be spent was being spent anesthetizing a patient. So, and those things affects the treatment that's coming out of hygiene for the doctor, and it also affects the treatment that the patients are being presented to, because then when you get back in the chair and all you have time for is a prophy, guess what? That's all that you're going to be able to do.
Yeah. So true. So true. Now, if I'm listening to this, and you and I chatted about this, Rachel, I love this. I don't have any time. You guys are coming into my office. Can you guys just be our clinical lead? And you said abdication. Can you abdicate this and give us the philosophy behind that?
Mm-hmm. So I would say this, and I would say in a multi-doctor practice, just today, we had a conversation with a multi-doctor practice about their hygiene protocols. And while they all are responsible for upholding the agreed upon standard of care that they all created with their team, there is one doctor that is going to step up as the go-to for the hygienists, right? So that's a nice thing about having a multi-doctor practice, is you might have somebody that's the go-to for implants. And, it doesn't mean everybody doesn't place implants, but that doctor may be the one that is really the clinical leader in that particular category, right?
Right.
You may have somebody that is the, IV sedation guru or the sleep guru that is going to, maybe they do see all of the sleep patients, but at the very least, they're going to be, when there's ever questions, they're going to be the one that they're going to go to. So I don't see that as abdicating. I see that as delegating and specializing, let's just call it that, like, for lack of a better term, and just really working smart when you have a group of individuals. We do get questions sometimes from practice owners to say, hey, if we hire you, are you going to be the ones that hold our team accountable to what they're supposed to be doing? And I say it's a shared responsibility between the practice, the clinical leader, right? The clinical leader and their coach.
Right.
So their coach, can kind of see the forest for the trees. They see how this is implemented has been done well over multiple practices and lots of different circumstances. The clinical leader is the one that's there every day. So if there's an agreement to, hey, when we do this perio evaluation and we're seeing, all this bleeding, but yet nothing was treatment planned, that's the job of the clinical leader, right? They're there day in and day out to bring that, and they can bring that to the table when there's a coaching meeting, right? And say, hey, so here's what I'm noticing, help us figure out what's going on and what support the hygienists need to get back to doing what we agreed to on our standard of care. So, if you are a dentist as a practice owner and you're a single doctor, you are by default the clinical leader.
Yeah. Yeah.
Yeah. And it's a very, very important role. And it cannot be abdicated.
Okay,
yeah.
Cool. I love this. And so You mentioned accountability, so I love that word, like accountability. So, Rachel, how do I create the accountability? And let's say I want to update our clinical standards in this clinical lead. Do you have a regular cadence of meetings? And like, do we do this once a month, once a quarter? What do you recommend?
Mm-hmm. I would recommend working with a coach that can help you do this because they've done it, countless times, and they know what's coming and how to implement things. It's difficult if you sit down and create a standard of care. You may not be executing on those standards of care right now. So how do you know which one to start with, right? So they can give you some advice on that for sure. But I would say at a minimum, revisit your standards of care once a year.
Right.
Unless there's something that really dramatically changes in the industry, or you may have seen some cases in your practice to say, you know what? We used to think we could do this with the patient every once a year, but now we need to do it at every visit. Like maybe it's blood pressure, for example. Maybe you came up with a standard to say, once a year, we're going to do blood pressure screening, and you get 3 patients in a row that you do the screening and it's off the charts and they had no idea. You might change your standard.
Yeah.
You might decide, hey, we need to do this at every visit, and what equipment do we need? How's that going to work? So that's just an example, but I would say at a minimum once a year.
Yeah. I would imagine, and you probably run in this, dentists think of the exceptions or the challenges with this right away, but there's huge advantages to this. Can you speak to that? Like, let's say you get a clinical lead for a year or two. What are some of the intangibles or tangibles that happens with a team with a strong clinical lead?
So I would say it depends on how that clinical leader is communicating and what the intended, I'm trying to think of a specific example. So your question was, what are the tangibles? Okay, so tangibles, having a strong clinical leader is more consistent diagnosis according to the standard of care.
Yeah.
Okay. So when they know what to look for, and I would say use photos, right? When you're doing this, as much as you can, use photos of different scenarios, right? Of, if there's an MOD on a premolar, like we're never going to put another MOD in that premolar,
right,
because this is what happens. And you show the picture of the split tooth, right? That we've all seen. So I would say patients, the diagnosis is more consistently going to result in care that is following that standard. I would say you're going to be able to elevate the role of your supportive clinical teams, or your dental assistants and your hygienists. You're going to be able to elevate their role because they know how to follow. So what that means is, if you have made a clear diagnosis, it's in the treatment plan, and the patient comes in, periodontally they're healthy, but they see they have some incomplete treatment on the treatment plan, they know that you've diagnosed it, and they can support that. So they can say, hey, Kirk, I see that doctor recommended a crown on this tooth on the upper right. Let's take a picture of that today and see where it stands compared to how it was last year. And they're going to know, so this leads to the next tangible, is they're going to know that assistant or hygienist, that when you come in as the doctor, when the doctor comes in to do the exam, that when they hand that information to the doctor, that doctor is going to support that communication.
Right.
And they're going to be confident. And the more you support it, the more confident they become. And the more confident they become, the more they're going to pre-enroll treatment.
Yeah. I would imagine, because, and you know who you are if you're listening, sometimes we see dentists that just don't diagnose because they're afraid, and I think the value, there's so much that we could talk about in the value of a team member. Having a clinical lead and an assistant who's bought in on the clinical standards can up the game of the doctor, because I don't know if you guys do this, but we actually recommend that the doctors are held accountable by the chairside assistant. Mm-hmm. Just how much did you talk about today? How much did you diagnose? And just by doing that alone, the assistant will go, listen, they told me I'm supposed to track how much you discuss, and you're not talking about anything today. And so give us your background, like your thought on that. And
So I will say, a flip side of that is that think about the doctor that's doing 2 to 3 hygiene exams per hour and just came out of a procedure, for those of you that are watching this, they're doing a procedure in something that's like the size of the end of this pen, right?
Mhm.
And they've got to get it just right. And then they come in and maybe they come in to do a hygiene exam and they're having to like start all these conversations from scratch. Sometimes they're just tired.
right.
And they just don't have it in them to do it. They know they've got to get back to this patient. I do an exercise in my speaking programs about kind of illustrating dentists are much more likely to get up to go do a hygiene exam, to get up from a procedure to go do a hygiene exam in a timely manner if they know that hygienist is going to have radiographs up, photos up, is going to have talked to the patient at least about the problem, right? And if they've even suggested what doctor might recommend as a solution, then, oh my gosh, they know they can step into that room and 8 times out of 10, they just have to be the bobblehead, right? They're just like, yep, that's exactly what I would recommend. You see the crack right here. They're looking at that monitor with the photo. It's up when they come in. That is a like secret weapon for getting your doctor into your hygiene room faster.
Yeah.
Is when and I've had countless doctors say, yeah, that's absolutely true. When I know that things are going to be prepared and ready, there's a clear handoff that's consistent. And then imagine having all of your hygienists on the same page doing the same thing.
That's beautiful.
Beautiful.
I love it.
Exactly.
It makes perfect sense.
Be done.
Yeah.
Yes.
Because a room in which it's not set up is like, oh gosh, we got to start all over. It just sounds like a heavy lift.
It is a heavy lift. And so that's why they're taking long. That's one reason, right? That's not always the only reason, but that may be one reason why they're taking longer to come in for the hygiene exams is they're finishing up because they know this is going to be a heavy lift and they want to keep their focus in this procedure that I'm doing right now.
Yeah.
So it is a heavy lift. And what happens sometimes is that the doctors just come in, they're like, okay, we'll see you next time. Everything looks fine. Right? Because they just can't, it's a lot. It's a lot of mental energy to start that conversation from scratch. Maybe it's a patient that they know always has a lot of questions. They're like, I can't go there right now because I've got somebody else. And if I spend 15 minutes in here, I'm going to have to re-anesthetize them. Like they're processing all of that in their mind and it's a lot.
Yeah.
Yeah.
Yeah. We often don't talk about how fatigue plays in, decision making.
For all of us, right? For all of us, for sure.
Yeah.
I actually saw that on a team survey recently. We were reviewing some incoming team surveys from a new client, and that was one of their requests, reduce our decision fatigue. So having clear written standards helps with that. Now, I would never say, in fact, we tell there's no cookie cutter approach to live human being patients, right? They're all going to present slightly different. But if we at least have a framework from which to work, and we know that our whole team is committed to the same standards, it does reduce the fatigue because we have something to go to. We have a go-to.
Yeah. Amen. I absolutely love that. And so I do want to ask you about this because this comes up in almost every podcast is like, okay, listen, Rachel, I totally value this. I think it's a great idea, but I have a team of 18 and I think 3 of them or 4 of them are going to go for this for sure. So how do I approach that one?
Yeah. Yeah. So I would say, first approach, so let's define this a little bit better. So approaching the team to better tee up dentistry or approaching someone to be a clinical leader? Well, a couple different conversations.
Yeah. So let's say we appoint a clinical leader.
Okay.
It's the right person for the job, and they're doing all this work. And then they come to the doctors and say, listen, I'm part of this clinical lead team, and we have 2 or 3 people that aren't doing the work. And I'm following up to make sure that everyone's accountable, but I don't think they're ever going to do this.
Yes. So then that's where having a written standard of care comes in handy, right? And again, this is not a dictatorship, so it's not something that the clinical lead does in the closet, or over lunch and then hands it to everybody. Everyone has to buy into it first and foremost. Then they have something to go back to and say, hey, I've noticed that, in my chart audits, and if you're doing chart audits, it needs to be known by everybody that chart audits are being done. It should not be a secret, because then all of a sudden it feels like a violation, right? But if you say, hey, one of the jobs of the clinical lead is to keep us all on the same page, and they're going to be doing chart audits every month. So what I'm noticing is that, these patients do not have photos. When we're recommending treatment, there's no photo. So tell me about that. Like, I want to help you get consistent with this. What support do you need? And then find out, is it a lot of times it's an equipment issue.
Right.
And maybe they told somebody and never got fixed, and they just got tired of telling that person over and over. Sometimes it's a timing issue or figuring out how to put it in the workflow. Sometimes it's a confidence issue. So just asking. It's surprising how often leaders don't have conversations with the people that they're leading. And when they just go in with like a no expectations, like take off any sense of like frustration or defensiveness or anything like that, just go in curious, like, hey, like, how could I help you fulfill, the standard of care that we agreed to? Tell me a little bit about what's happening there. A lot of times you'll get to the root issue. Now, I do want to address one thing that you've mentioned, because there's the clinical leader and then there are clinical leads. So in a large practice, yes, very often there could be a hygiene lead designated, right? And ultimately there is still one clinical leader in a dental practice, and it is a dentist. It doesn't have to be all the dentists, but it has to be a dentist. Okay. Unless this is you're in a state where a dental hygienist can own a practice, right? That's a different animal. But I think that those clinical leads there has to be a communication or a transfer of authority in a very positive and supportive way to those individuals, so that they can say, hey, these are our practice standards of care.
Yeah.
And then if you've done everything to do to support them, then you do have to kind of go up to the next level clinical lead and ask for support.
Yeah, I'm so glad you clarified that, because I'm sure that's a question that'll come up. Now, I love this concept, and I want you to tell people, I know people are listening to this, they're going to want to learn more about what you do and how they find out more. But before we do that, give us some final thoughts on why every practice needs a clinical lead.
Every practice, if you haven't already, I would encourage you to just create either core values or your vision or whatever it is. Like, what are you about as a practice? And what are you truly to your core committed to? And it starts with the practice owner, and then it must be communicated in order to trickle down to the team, right? And then be sure the value of the clinical leader is then being sure that those clinical procedures, like why the patients, that's a core of your business, right? The service that you provide, is it matching those core values? So if you say that we are, we are current and we are a high-tech practice, right? Are you current? Are you implementing current standards? Are you seeking current standards? And are you implementing them in your practice? This is my kind of bubble, but like the AAP staging and grading came out in 2017, was really released to us in 2018, right? That's not a new standard anymore.
Right.
6 years this has been out, right? So we are current, we are modern, we are high tech. Like, are you? Like, really take a critical look at it and see where there might be areas that are missing there. So that's a role of the clinical leader. And then really prioritize where you want to go, because, like me and you, we all want to do everything at one time, and then everybody on the team's head explodes. So pick one thing, right? Whether it's a department or it's a category of service that you really want to create this clear standard of care. And I'll tell everybody, we have a worksheet on our website so that will help you start. So if you go to inspiredhygiene.com, you'll see there's a tab that says resource guide. And if you drop down, there's about 8 different resources there. And one of them is called the Standard of Care Worksheet. It's free, and you can get it, and it will help you start this process. And you could probably take it and apply it to, other pieces of the practice as well. So that's there for you as a resource.
You're the best. So you guys heard it straight from Rachel. You have to check that out. Now, if you're not taking notes, don't worry. We are taking notes for you. You can flip up to the show notes, and there'll be a link right there. And you can click right on it and do it. I promise you, anything Rachel does, it's always amazing. And it's a resource that'll help you great. Now, give us a little bit more. I want people to know how to find you, how to reach out to you. I know they're going to want to learn more about you. So where do I go?
Yeah, so go to inspiredhygiene.com. And if you would love to just have a conversation about this, see how we might be able to help you in your practice, you'll see a link to book a discovery meeting. It's low pressure. And what we do is we give you the opportunity to share a little bit of hygiene data with us, and we can show you where you likely have some immediate areas of growth and what that would look like for your practice. And we'll be happy to share that with you. So yeah, reach out to us there. You can email us at clients@inspiredhygiene.com if that's easier, and we'll find some time to get together. But yeah, thank you for the opportunity. Always love being with you here.
Yeah, it is awesome. And we're going to have you back again and again and again and again. Right. And so awesome. Well, I appreciate you. Stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. Hey, if you enjoyed that, which I know you did, do us a favor, just hit the share button and share this with your friends. And keep sending us suggestions for things you guys want to see. I'll have Rachel back again and again, and we'll ask her the questions you guys have. And just make it easy. How's that? So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.